Giardia, also called beaver fever, an intestinal infection caused by a giardia parasite. Giardia is a tiny microscopic parasitic organism that leads to this diarrheal sickness. This parasite is often found in contaminated water, food and fecal matter of already infected animals or people. This parasite is protected by an outer shell-like covering and can stay alive outside the human body for a prolonged period of time. The most common way in which this disease spreads is by contact with contaminated water, drinking or swimming, food exposed to manure or washed in agricultural runoff, handling diapers, living in squalid conditions and unprotected sex. Symptoms. Symptoms can vary a lot amongst those infected by giardiasis. While some people do not display any symptoms, they may end up releasing cysts through stool and thereby pass the disease to others. Other people may develop chronic or diarrheal sickness within 1 to 2 weeks of contracting the infection. Small children are particularly susceptible to this infection. Some common symptoms are diarrhea with large amount of watery stool initially, gradually turning greasy and foul-smelling. Weight and appetite loss. Failure to absorb fat, digest milk and vitamins, A and B. Abdominal cramps, vomiting. Headaches and nausea. Constipation and gas. Small children are particularly susceptible to this infection as severe cases of giardiasis infection can lead to slower physical and brain development and can lead to malnutrition. Diagnosis. Routing over and parasite examination through analysis of fecal discharge is a common method used to identify giardia. The most effective method is a routine antigen testing of the stool. Since the cysts are excreted intermittently, it is important that several stool collections are made on separate days. Treatment. In patients having giardia infection without symptoms, no treatment is usually prescribed as the infection clears out on its own in a few weeks. Medication. The most popular one is the antibiotic metronidazole. The common side effects encountered is a metallic taste in the mouth,